All right, so hello, folks. I wanted to introduce a new person in our practice, Dr. Wise. She's joined us a few weeks ago, and she's going to be spending a year with us, just learning some advanced techniques, and she's already very good at all these things. She's board eligible, she's completed her residency, and she's going to be spending a year with us, and then if she likes us and we like her, maybe she'll stay with us forever. So those are all possibilities. So tell us about yourself, Dr. Wise.
Well, first of all, I'm so excited to be at this practice. I've already learned so much in the couple of weeks coming up, and I'm very excited for the year ahead, and really just adding into the practice. It's super exciting. I am from St. Louis, Missouri. I did school in Kansas City at the University of Missouri, Kansas City. Was med school and undergrad, and then I did a year of residency at Baylor College of Medicine in Houston, another year at Stanford in California, and then I finished my residency training at Loyola in Chicago. Graduated residency this past June and had joined the practice at the beginning of August, and it's been a good time. I am interested in pursuing a career in minimally invasive, robotic, bariatric, and general surgery, for which it's a super exciting and amazing field, and I'm excited for what it has potential for in the future.
Wonderful. So tell me, why did you choose bariatric? What drew you to bariatric surgery?
It actually, when I joined residency, that wasn't my initial thought that I was going to be into bariatric. I found it a little bit later. But I like the long-term commitment relationship to your patients. You're following up with your patients. You have a very strong, solid relationship with them. There's a very large preventative component. Bariatric surgery is amazing in that it helps people lose weight and helps improve their comorbid conditions that are related to obesity. And that component was very nice for me. And I think robotic and laparoscopic surgery is the ultimate future of abdominal surgery. And so I wanted to get ahead of the game on that one. So a couple of different things. And then the surgeons themselves are just super awesome. They're great for patients and they're fun to do.
Wonderful. Okay, and what about robotic surgery? Why do you think it's the future?
Robotic surgery. So a couple of things about it. One, it's more ergodynamically beneficial for the surgeon, and has been shown in many ways to be helpful from that standpoint. But also the technology itself. You have better camera control, you have better visualability. The fact that you have wrists on your instruments and are able to do more complicated maneuvers, I think, is super helpful as people become more and more strongly trained in robotic surgery. I think the time difference between that and laparoscopic surgery is going to basically diminish, and I think it's ultimately it's the direction we're going, just because you're able to do so much more with it, and do much more complicated cases, which tends to be the case in many of our patients.
Yeah. So which is your favorite operation?
My favorite operation, I like the fact that we have kind of a set curriculum. We do several different operations, but we all do a lot. And so I kind of like the variety to it. Some days I'm more in the mood for hernias. Other days I love a good gastric bypass. But really, I'm liking the bypass right now.
Sounds like a woman after my heart. All right, wonderful. Thank you.
Thank you.
We look forward to having a fruitful year with you.
I'm super excited.